Hello, I'm Mariah Spinola. This is my med administration video for NR226. Here's my ID badge. ID number is 41095801. Here is my 360. This is my patient's room over there. R and stuff's right there. I'll show you in a second. Okay, so I have my MAR here, and doctor's orders. Okay, so I'm just in my med room here. Do some hand hygiene. Okay, so we have doctor's orders, just comparing. Susan Smith's doctor's orders to her MAR. The heparin, subcutaneous, 1,000 units, 1,400, ambient PO, 10 milligrams, 1,400. Okay, there are no discrepancies between the two. We have the right patient here, Susan Smith. It's her name on both the MAR and the doctor's orders. Heparin, subcutaneous, 1,000, 1,000, 1,400, ambient, PO, 10 milligrams, 1,400. So we have the right drugs, right routes, right dosage, and right times. Now before I begin, I'm just going to do some medication calculations. Okay, and I'd have a nurse double check them. And now we can do our first label check. So we have heparin, right drug, subcutaneous, right route, 1,000 units, right dosage, and 1,400, right time. And then we have Ambien, PO, 10 milligrams, 1,400. Before we go any further, Susan Smith, let's just confirm she has no allergies. So both these medications will be fine, and she has no contraindications to either heparin or Ambien. Okay. So we did our first medication check. So we have the right drug, right route, right dosage, and right time for them both. Now we're just going to prepare the medication. And just going to move my camera just to show you that I'm recapping. Sorry, I usually wouldn't do this obviously, but I have to show my camera. The swoop mechanism. Okay. And now before I go, I'm going to do the second check. So we have heparin, right drug, subcutaneous, right route, 1,000 units to 1,000 units, right dosage, and 1,400. It is 1,400 right now, so right time. And then we have Ambien, which I won't open until we get to the bedside. Ambien is PO, 10 milligrams, 1,400 right now. So we have the right drug, right route, right dose, and right time for them both. So let us head over to the patient's room here. We can do our assessment and all that jazz. Knock, knock. Hello, my name's Mariah. I'm just gonna set my medicine here. Your student nurse today. I'm just gonna give you some medicine. I'm just gonna set it here on this clean surface. Okay, let me just provide us with some privacy. Do some hand hygiene. Can I get your name and date of birth? Okay, check your wristband. Okay, Susan Smith. Awesome, Susan Smith on the MAR here, so we got our right patient. Okay, so Ms. Smith, do you have any allergies? No, in particular to heparin or Ambien, no allergies. And any contraindications to the heparin or Ambien? No? Awesome. So I'm just going to start. I'm just going to be giving you heparin and Ambien. Heparin to prevent any blood clots, and Ambien to help you sleep. Some adverse effects to monitor with heparin is bleeding or anemia, and then for Ambien is a allergic reaction we call anaphylaxis and any dizziness, but I'll be monitoring you closely as well. Do you have any questions about either drug? No questions. And then do I have your consent? Patient has consented. Okay. Sorry, I'm just noticing that one. Okay, so the patient has given me consent, so I'm just going to do a full head to toe, like a focused physical, and that would include the vitals, and then I'm going to assess my patient's ability to swallow, and they can swallow. So now I'm just going to do my third and final medication check. So we have the heparin here, subcutaneous, 1,000 units at 1,400, which is 1,400 right now. So we have the right drug, right route, right dose, and right time. And then we have the Ambien here at the right drug, right route, right dose, and right time. So that's the third and final check. Now I'm just going to begin by doing hand hygiene and putting on some gloves. I'm just going to be assessing the area that I'm going to be putting the heparin. Doing okay today, Ms. Smith? Awesome. To here, I'm going to get this over as quickly as possible. So just okay. So there are no lesions, there's no inflammation, no bony prominences, and no trauma to the area. So I'm just going to begin by getting a good area of subcutaneous tissue. Looks like I'm going to be able to go in at a 90-degree angle. I'm going to clean it off first. Let's clean it up. Away. And then I'm going to, with my non-dominant hand, pinch the skin and an inch away from the umbilicus. I'm going to go in at a 90-degree angle. You're going to feel me stick now. And just going to let go and stabilize the needle. I'm going to slowly inject the medicine. Okay. And I'm going to remove it the same way it came in at the 90-degree angle. I'm going to put the safety on and discard in the biohazard sharps. Okay, Just assessing. There is no redness, there's no bleeding, and there's no reaction present. So that's good. I'm just gonna put this bandage on. Go. Okay. Just gonna throw all this stuff away. Move my gloves. Some hand hygiene. I'm just gonna cover you up and put you at a 30-degree angle to take your oral medication. Here is a glass of water. I'm going to open the Ambien and give you that. Here you are. Okay. Okay, patient has taken the medicine. I watch them take it. So now I'm just going to put the bed in the lowest position. I'm going to lock it, put the side rails up. Here is your call right. Call me if you need anything. Just thank you so much. I'm just going to finish by doing my documentation here. And I'll be out of the way. Okay. I'll do my documentation. We have the right chart here for Susan Smith. And we have Ambien and heparin as our drugs. Ambien was PO at 10 milligrams. So we have the right route and dosage, and at 1400. So we have the right time. The heparin, subcutaneous at 1,000 units. Did I say 10 milligrams for the Ambien? So we have the right route and we have the right dosage for that, and 1400 right time. So our assessment that we got before, there's no known drug allergies, no bony prominences, no trauma, no inflammation, no lesions. And then the patient tolerated both meds well with no reactions, bleeding or anything, and they understood teaching about indications and adverse effects. There were no medications refused or withheld. Signed, Mariah Spinola, student nurse. Okay. And there's that. Thanks so much.